Hey, good afternoon and welcome to Body Talk. Today we're going to talk about something very topical. This is January, well, the end of January 2018, and we're in the middle of a, if we call it, flu epidemic.
Yes.
Is it at that point now?
I believe so.
So we want to give you some advice of how to avoid it and what to do if you do get it, and some facts and different things about the vaccination. So I'm here with Marlene Childers, who is an RN at the local hospital and the nurse here at the college. Mm-hmm. That's the number one job.
Yes.
Is taking care of our students.
That's right, and that's a priority.
Right.
And so there's concern, of course, about the flu, also known as the influenza. So I'm going to just start first by
maybe defining it
and how it is spread. So the influenza is spread through small droplets containing the flu virus. And these droplets are expelled into the air when people breathe, cough, or sneeze, and they're infected with the flu. So once in the air, these small particles, these infectious droplets, can land in the mouths of healthy people, such as you or I, or in their noses, to anybody that's standing nearby. They attach to the cells within the nasal passages and the throat, as well as the respiratory system, known mostly as the lungs. And
okay.
So
now if somebody, I know you cough and expel these germs. Okay, what if I cough onto the table or cough onto my hand and I pick up something, like a ketchup bottle, and then you pick it up and then you
yes.
touch your face.
And so it's also spread by touching any surface or object that has the flu virus on it. And so then they'll touch their mouth, their nose, or even their eyes, and then they're, pretty well on their way to the flu.
Right.
Okay? And so we'll talk about some signs and symptoms here of the flu.
Because I think there's some, confusion. Do I have a flu, or if I have a cold, do I have the flu, or just the cold?
And so all the symptoms kind of mask a cold, or the cold masks the flu. However, with the flu, the symptoms come on very suddenly. And the number one defining element of the flu is fever and chills. With a cold, you don't get a fever.
Okay, is this fever a high fever or a low fever? It just depends on the person.
Well, according to CDC, it can be a low-grade fever, but typically in a clinical setting, we see generally high fevers, fevers that are well over 101 degrees.
Okay. And should you do something about these fevers, or when is a fever, warning sign, and you have to do something?
If you have a high fever, that would be the time you would want to go to the doctor, because most likely that is not a typical cold. That is most likely the flu. It's a viral illness, and so with that, generally with a virus, you do develop a high fever.
And since it's a viral thing, then it's not something you can get antibiotics for.
No. However, they do prescribe antibiotics for secondary infections such as pneumonia. Because like I said, those droplets that are in the air, they grab onto the mucosa in the nose or the throat or the lungs. And so that's why the flu is generally known as a respiratory illness.
Okay.
But other signs and symptoms of the flu are a cough, sore throat, runny, stuffy nose, muscle and body aches. And there's an element there too that generally you don't get with a cold, an upper respiratory infection. So that's another defining element of the flu, in addition to the fever and chills, is the muscle and body aches.
I think we have a nice portrait of a flu.
Yes, we do. It's a virus, and so let's show that portrait of the virus. So that is the flu virus right there. That's what it would look like under a microscope. And so you can see where it kind of down there on the bottom, that's where it's kind of attacking, going into the respiratory cells. And once it's in those cells, it's locked in, and then it just migrates. So
how do you get over it? Is it just a cycle and it runs its course and then it goes away?
well, you know, if you get to the doctor when you have a high fever, then a lot of times, and you've got to get in there within 48 hours. The physicians will test you, or the practitioners. It's
The
not
swab,
necessarily. Yes, it's by a flu swab.
Okay.
It almost kind of feels like you're getting a lobectomy because we literally take a swab, and we have to get clear up in here into
Wow.
this nasal part. And to get up there, we try to do it very quickly because it's somewhat discomfort.
Yeah, make your eyes cross.
Yes, and it will cause you to, get watery eyes. It's not pleasant, but that is a way of testing for the flu. It's called a quick flu swab, and you can have results within 15 minutes. And so most often, if you get in within 48 hours, the providers can prescribe an antiviral.
Is it the Tamiflu?
That is Tamiflu.
So what does that do?
Okay, so what that does, it shortens the span of the flu by
Severity?
2 to 3 days, and the severity as well.
Okay.
So not only is it, working on the time frame there, but as well as those symptoms that we've described, it lessens those. So if the best thing to do, if you develop fever and you have all the signs and symptoms of the flu, and a lot of times that includes headache and fatigue as well, and it can even be vomiting and diarrhea. That's another sign of the flu. But that's mostly common in younger children than adults. But there have been a few adults here that I've noted that have had the vomiting and diarrhea. So that kind of goes along with it too. This is just a really bad flu this year. And it's hitting a lot of people, even healthy people. But generally, if you get in and get the Tamiflu, then that helps with the symptoms.
All right, and preventing it, what's important to do to prevent it, other than being a hermit?
Well, here's the thing. If you think you have the flu, like I said, the best thing to do is to see a provider and get in and get treatment and diagnosis, proper diagnosis. And most often in the first 3 to 4 days is when you're contagious. So
stay
you don't,
home.
Yes, you don't want to be out. You don't want to go to the grocery store. You don't want to be at school. You shouldn't be at work. I mean, you need to just stay in and stay away from people. This is how it's spread. People are, they don't really realize they probably have the flu, and then they're out and about, and then it's spread,
Yeah. Don't try and be the tough guy. It's like, I can go to work. I'm sick, but I'll get through it.
Exactly.
No, you're endangering everybody else at your
Exactly.
workplace.
And especially in school and work areas, you know. There's been a lot of schools that have closed down. I've seen on the news in West Virginia and throughout Ohio. And they're saying that really they don't think it's even peaked yet. So normally the flu runs up until March, and it generally has peaked before this time. So this has not yet peaked. We're
Now,
still getting cases.
Why does it happen in the winter? Is it just because we're all inside, or why is it we always get sick and get the respiratory stuff during the winter time? Now, I
Well,
understand sometimes the stuff in the house, maybe it's drier because of the heating and all that type of stuff, but why is it the winter time? Do you know?
I would think just because we're more enclosed and it can run up through April. There's been a few cases noted in April, but yeah,
But you don't generally see it when you go on vacation at the beach or whatever, you know?
No, it's just, the flu season, it is what it is. It runs through October through April. That's pretty much, and I'm not sure the etiology of that or the rationale as to why.
Do people in warm climates get it?
Well, it is spread all across the United States. If we could show a map. Okay, this map here.
Week ending October.
Right, it was the
7th.
week of October, week 40 of our year. And you can see there that most states had no activity. It was kind of sporadic throughout the south and the north, and then it started kind of migrating and going across the United States.
See
So if
Colorado
we
and
could take another look at
South
another
Carolina.
map. This is the map that ended of
January
week
20th.
3, week 3 of the year, and you can see it's widespread. It's all across the United States, and it's been a while since they've seen it this bad. The only state that's not affected is Hawaii. So I think we just need to get on a plane and head
Well, that's
to
what
Hawaii.
I was saying. If it's warm, do they have it in Mexico like this, or?
Well, yeah, even
and
out
say
west.
like Brazil, do they get it in their cold?
That I don't know about other countries. I haven't researched that, but it's just something that occurs October through April, and it's just the flu, the
Okay.
flu season. That's defined as the flu season. So I'm not sure, whether the weather has any play into that. I don't know about that.
Okay. Well, we're going to take a short break here. We're talking about the flu, and we'll see you on the other side.
Okay.
I'm here with Marlene Childers, the school nurse here at the University of Grande, who also works at the local hospital in urgent care. So she sees a lot of different people, and amazingly, you haven't gotten sick. But
Amazingly. Yeah,
so we're
it's
talking
blessed.
about the flu and the bad flu season and what you can do besides getting the flu shot. We'll talk about that in a little bit. But what are some of the things that we can do to avoid getting it?
Okay. Well, your first line would be vaccine, okay? Immunization against the flu. Now, this year, they're saying that the flu shot worked about 10%. I did hear some reports that it was like 10 to 30%, but I'm mostly hearing 10%.
Okay.
So, there's all kind of different strains of influenza. And so, they just kind of work in the labs to get the vaccine right for that particular strain, and they kind of go from what was last year and so forth. There's two different vaccines. One is a trivalent, and the other one is a quadvalent. And so tri means that it's hitting 3 different types of strain, and the quad is like 4 different strains. And of course, it's more expensive than the tri, and most generally, the tri is what we get here on campus to give to everybody, because that quadvalent is a lot more expensive. So, I've never gotten the quadvalent here, but the tri is just as good. It works. So you never know, if the strains are what's out there. And so this year, evidently, they only hit it about 10%. Yes, but
I've heard you should probably get plenty of rest. Don't walk around tired and dragging around. That lowers your immune system. Get plenty of exercise. Eat well. Get your vitamin C and D. I'm not sure if you get too much D, that's not good. And how can you tell that you've got enough D besides getting a blood test? But those are the things you need to do besides like staying away from people. And if you're one of those people and you have to get out, say like if you're going to the hospital to urgent care to see somebody, maybe for a different problem, maybe for that problem, there are masks available.
Yes, there are.
And washing your hands, of course.
So,
and don't touch your face if you can.
Yes, so other preventive actions are staying away from people, of course, who are sick. And if you are sick, you stay home. Covering coughs, sneezes, and this is not the way to do it. You want to do it this way. So you want to cough or sneeze in your arm so that you're not getting that on your hands. And then you go and touch a desk or a doorknob, and then somebody else comes along, touches that doorknob. The flu virus can live on surfaces for 24 hours. So
I think the worst thing in the college or maybe office environment, especially if it's an open lab, is a computer. The keyboard and the mouse,
That's
I
right.
hate to be gross, but people are picking their nose and they're
you're
coughing and
absolutely right.
sneezing,
Yes.
and they're touching all this.
Yes.
So if you have to do that, then if you're going to touch it, don't touch your face or any mucous membranes.
Right.
And if you can, disinfect this stuff.
Yes, and so I think here on campus, I have asked all staff and faculty to kind of be proactive and wipe down, with their antibacterial wipes, wipe down the surfaces, computers, and so forth. And so that has already happened. I talked to campus networking, computer and networking, and so they've already been very proactive, and they've gotten a lot of help in doing that and going around campus wide wiping down things. So
that's good. And you just have to
hats
look
off
for
to
these
them.
things that we share that don't get cleaned, remote controls or like your ketchup bottles or doorknobs and different
Right.
things. And you see when people go into the bathroom, sometimes you'll see paper towels by the door. Well, that's somebody that like dried their hands and took the paper towel and opened the door, then threw it down.
I do that. I do that all the time in restaurants and everywhere. I'm just, really funny because I'm one.
Well, you see the results.
Yes, I do. I live them every day at work. But here's the thing. We're healthy, but there's very young children that are contacting the flu.
Is that up to 2 years old?
And they, you can get the flu vaccine at 6 months. And so any child, any child that's a newborn or, up to 12 years old. But the young children are who are at most risk. The little babies, the younger children, the toddlers, because their immune system, isn't fully developed. And so I will tell you this, that if you have a child at home and you think they may have the flu, you would want to seek treatment in the ER if that child starts having heavy breathing or trouble breathing, their skin color is blue, they're not drinking enough fluids, or they're not waking up or interacting, they have a fever that keeps going up higher, and they're just not improving. So those children need to get into the ER. That's ER.
And that's another thing that's very important to staying healthy, is drinking enough water. You got to stay hydrated, and
That's
it's
right.
not just for sports people or whatever. You need that fluid flushing through your system all the time.
Right.
Especially if you've got, if you're throwing up or have diarrhea. That's liquid leaving our body. We got to replace that.
You can get dehydrated, yes. And
How about, older people? What's the deal with them?
so, the adults that are high risk are those who have chronic problems like chronic lung problems, because it is a respiratory virus. So, as well as diabetes or heart disease, those people need to be seen immediately. And so if an adult has shortness of breath or pain or pressure in their chest, dizziness, confusion, severe persistent vomiting, then they need to be seen in the ER, because those are the ones we worry about. The adults with chronic health problems and the young, very young children.
Now, I've seen there's been, quite a few deaths, and it's, I don't know if it's above what we normally see or not, but there have been quite a few deaths as a result of the flu. Now, do people die from the flu, or is it something else around it?
I believe that it's something secondary. They have the flu, but they come in, they've got pneumonia now, because again, it's that respiratory thing. And so, any one of us who gets the flu, it could go into pneumonia. So,
How do you know if you got pneumonia?
Well,
Because it's kind of a sneaky guy.
it is. And so if you're not getting better, if you're feeling worse, then, that's a good indication that you may have pneumonia, because you're not going to get over that.
Now, what you do as a nurse, if I'm right here, to listen for pneumonia is if you have a stethoscope, you listen at the lower part of the lungs and have them breathe deep, and it sounds like you've got a straw in a glass.
Well,
Just gurgling and bubbling.
you listen to all the lung fields.
Okay.
There's different bases in the lungs,
Okay.
and so as a nurse, you know where to listen. And so it's not just the lower lungs, but it's the upper and the mid and lower lobes of the lungs. And yes, you can pick it up with a stethoscope. Your breath sounds may be diminished. You may have like some wheezing in there, or crackles. Lung fields, you can hear breath sounds clearly. With pneumonia, you cannot. Like pretty much know. And then they come in, their SATs, their O2 SATs are low, because they're not getting that oxygen through, through their lungs.
And pneumonia is fluid in the lungs, correct?
Pneumonia, well, that's called atelectasis.
Okay.
Pneumonia is a bacteria that takes over your respiratory system. And it's a life-threatening, you know, if left untreated, it can really have serious effects, especially in those high-risk adults that I was talking about, you know, the ones with diabetes, chronic illnesses, you know, cancer, any weakened immune system. But as of on January the 20th, there has been 38 pediatric deaths related to the flu. Week 51, which was a week before the end of December, there was approximately 1,647 deaths across the United States related
And
to
that's
the
not
flu.
really uncommon because there's people that die from the flu every year.
Yes. But these numbers are
they elevated?
significantly higher
Yeah.
than previously.
Okay.
We don't-
Looks like we're out of time.
Okay.
So we could probably go on for another half hour on
We
this.
we could.
All right. So everybody stay rested, stay healthy, do your best, stay away from people, and stay safe. And we'll see you next month.
And good hand washing and rest.
Right.
Okay? And if you think you have the flu, please seek medical treatment.
Right.
Okay?
Take care.
You. That